How much do you really know? Bladder and bowel facts. The average person passes approximately 1.5 to 2 litres of urine in a 24-hour period. The need to empty your bladder is controlled by your central nervous system. What is incontinence? Incontinence is an involuntary loss of urine or feces. It is not a disease, but a symptom of an underlying condition. 1 in 3 women and 1 in 9 men will suffer with urinary incontinence, and 1 in 10 people will suffer with fecal incontinence at some point in their lives. Types of incontinence. Stress urinary incontinence. This is caused by weak pelvic floor muscles. This type of incontinence is more common in women than men and is linked to childbirth, but it can also be linked to obesity and constipation. In most cases, this can be treated or improved by following professional medical advice. Urge incontinence, overactive bladder. This is when you have a strong urge to pass urine. Leakage can vary from a small amount to a whole bladder loss. Mixed urinary incontinence. This is a combination of stress and urge incontinence. Overflow, outflow obstruction. This can commonly be linked to a blockage such as an enlarged prostate or neurological problem. Functional incontinence. This is a result of physical, cognitive and environmental difficulties. Fecal incontinence. This is an involuntary loss of solid or liquid stool. With all types of continence issues, please seek medical advice as treatment may be available to cure or alleviate symptoms. Dispelling the myths. Myth. It is normal to go to the toilet more than 8 times a day. This is false. The number of times you pass urine may be linked to what you drink and how much. Too many caffeinated or alcoholic drinks can cause you to pass urine more often. Most people empty their bladder between 4 to 7 times in a 24-hour period. Myth. Poor bladder control is not associated with men, it is usually a women's problem. This is false. Both men and women can develop continence issues at some point in their life. Conditions that decrease mobility and neurological problems can have an impact on continence. These issues are not usually gender specific. Myth. Urinary incontinence is something you have to live with. This is false. In approximately 70% of cases, urinary incontinence can be cured or improved following medical guidance. There are many options such as pelvic floor muscle exercises, medication and surgical options depending on individual circumstances. Myth. You should have a bowel movement every day. This is false. This can vary from person to person. Some people may go up to 3 times a day, whereas others may go 3 times a week. Although having a bowel movement once a day is common, it's also fine to go a few days without. Constipation means having fewer than 3 bowel movements per week, or passing very small hard stools. Myth. Holding it won't hurt. This is false. Sometimes people feel too busy to have a bowel movement, or would rather wait until they are home. Ignoring the urge may not only make you feel uncomfortable, it may also cause ongoing issues with constipation by weakening the signals over time. So when nature calls, answer. Myth. Your diet doesn't matter. This is false. Try to include at least 18 grams of fibre per day. Eat more fruit and vegetables. Remember to increase your fibre intake slowly to avoid gas and bloating, and drink adequate amounts of fluid. If you have any concerns regarding your bladder or bowel, seek medical advice. Continence issues are not a disease but rather a symptom of an underlying condition. Seek an assessment of your bladder and/or bowel by a healthcare professional. Choosing the right product. Abena aims to promote dignity and independence by ensuring you have a product that is as small as possible but as large as is necessary. Abena offers a full range of continence care products. Visit www.abena.co.uk for more information. For further information and advice, please speak to your GP or contact the following charities.